Hi, Dr. John here with NBC News on this Facebook Live. I'm going to cover some of the headlines you've probably heard over the past couple of days, and one in particular, and then we're going to answer viewer questions. So please, if you have any questions, go ahead and forward them to me. I'll try and get to as many of those as I can. But first and foremost, hopefully everybody had a fantastic weekend. You were able to get out safely and enjoy the outdoors, get some sunshine, but do it in an appropriate fashion, because that's part of what I wanted to cover here at the beginning. One of the headlines you're probably hearing are about the spikes that might start occurring over the next week or two because of what we did this past weekend. And you might have noticed in different areas, Lake of the Ozarks was probably the prime example that a lot of news sources were using, where there were parties going on where people were not social distancing, they were not wearing masks, and that has a lot of experts, and myself included, worried about what's going to happen over the next week or two, because we know that once we get outside, once we start getting closer together, we're going to see spikes in cases. What we don't want, and there's a huge difference between spikes, meaning a few numbers here and there, and outbreaks in certain areas. We've already seen outbreaks occur in different parts of the country, and those outbreaks have typically occurred because of gathering of people not doing that social distancing, not wearing those face masks. And so it's important that we all do that going forward. And I know this is one of those things that we want to get out. We want to get our freedom back, essentially, and get out to where we can enjoy things. But at the same time, we need to make sure we do that very carefully and very cautiously, because we're coming down that curve. We're getting at the backside of that curve, but we need to make sure that it keeps going down. Now, here's what's going to happen over the summer. Coronavirus is probably not going to go away. It's probably going to get to be an undercurrent of coronavirus. It's going to be low numbers popping up every now and then. Hopefully systems are in place to keep those spikes from turning into outbreaks. And that means a couple things. One, that they can go ahead and test people to find out who has it, whether it's the diagnostic test like the nasal swab, the throat swab, or the saliva test, or the antibody test, which is a blood test to find out who had it. Once they go ahead and do that testing, especially the diagnostic test, they need to have a couple other things in place. One, if people are positive, meaning they have coronavirus, they need to isolate them. Then with the positive people, they need to contact trace who was around them, and those people who are around them who are at risk for getting it need to have quarantines put in place. They need to stay in place for 14 days so they don't spread it in case they're either asymptomatic or they start getting symptoms after 5-10 days of having this virus in their body. So again, the four things that need to be in place are the testing, then the positive cases get isolated, their contacts get contact traced and tested, and they also get quarantined to make sure it doesn't spread to other places. You might see that going on throughout the whole summer. That's the hope behind this, that when you see those spikes, you see this happening, because that'll keep it from coming into outbreak type situations, which we're all very, very concerned about. Now, one other thing, and this is pretty much right hot off the press. We've all been waiting for this, but the CDC just came out with their statistics and a map showing an easy place you can go to get numbers. And their numbers are a little different than NBC numbers, and I'll show you that in a minute here. They're not off by much, but the difference there being is how that data is collected. The CDC tends to, with the flu or anything else, be a little bit behind other people, and that's mainly because they're focusing on making sure that they get cases that meet their certain criteria. So you can see here, and hopefully you can see this. And what it is this is a CDC site. And if you go to cdc.gov/covid-data.tracker, this is what you get here. And it just came off. And it's basically showing the states that have the numbers of COVID cases, the total COVID cases, which unfortunately is 1.662 million. And then the deaths, which is one of the things we're going to talk about here, 98,261. If you look at NBC's site, our deaths are 98,973. So there's a bit difference between the two. One has 973, one has 261. So I'll show this to you real quick just so you can see it. And hopefully you can see the address as well. I'll give it to you here in a second, but it's the CDC site, cdc.gov/covid-data-tracker. And again, it shows you the numbers, it shows you the map. It's going to be a great place to go to, in addition to going to NBC to finding out information about what's happening in the current environment with COVID. Now, that 100,000 number, you're probably going to see us hit 100,000 deaths from coronavirus, from COVID-19 here in the U.S. today or tomorrow. That's a grim milestone, not one any of us have wanted to get to, but one that's been predicted to get to by a lot of people by June 1st. Looks like we're getting there a few days early. What that means, again, is that this thing continues to happen, continues to go on. Now, the concern is there's a difference between what we call these spikes or an uptick in the wave again, and then the second wave. The second wave is going to be in the fall, and that's when it starts making its comeback again. We think this is more of a cold weather virus, although it's not going to completely go away in warm weather. But once it starts coming back into cold weather, we think it's going to come back in force again, which means we're probably going to have some of these things in place that we've had now. And it's a lot of things that people don't necessarily want to do. And one of the hardest things to do, and I always call it trying to put the toothpaste back in the tube. Once people get out and they start getting back to their regular lives after being essentially quarantined, sheltering in place for 2 months, they don't necessarily want to go back and do that because they've seen what they've done over the last couple of months. It's something we might have to do again in the fall. So definitely start thinking about what you need to do this summer to prepare for the fall. And if they do tell us to do that, please, let's go ahead and do that, because the sooner we do that, and we have found out this time, one of the big issues is a lot of experts have said that if we had done things 2 weeks earlier, we would have gotten a lot less cases. And so I think you're going to see the government and different local sources jump early to get us to shelter in place, to get us to do that more social distancing and wearing of masks than you did this time, only because they want to make sure that they really get the cap on those outbreaks immediately so we don't have the issues we've had this time. But again, a couple things. One, this past weekend, there were instances across the country of people not doing the social distancing and the wearing of masks. And so I think, unfortunately, you're going to see outbreaks over the next 5 to 14 days, because the incubation period is 14 days. People typically start getting symptoms about day 5, and hopefully systems are in place in their local area to keep that from turning into even bigger outbreaks. But I think, unfortunately, that's what you're going to see. 100,000 deaths. We're very, very close to that right now. It's not something any of us have wanted to see or hear about, but we are there, and hopefully it doesn't get much worse than what it is right now. And the fact that we're going to see these spikes, we're going to see a few more outbreaks, it's going to quell down a little bit, and then come spring or come wintertime, we're going to see these things pop up again. So let me go ahead and get some questions from you to see what you have, and we'll get to those right now.
Hi, I know we're supposed to have masks or wear them. Do regular homemade masks work, in your opinion?
So the question is, we know we need to have masks. Do homemade masks, the cloth masks we're talking about, do they work? They do work very well. They aren't going to totally protect you. Even an N95 mask, which is kind of the mask that sets the standard for all this, can still let in some virus, especially if it's not fitted well. Home masks, though, homemade masks, number one, they're easy to get. Number two, they're a bit more comfortable than those N95s. You can wash them after use and wear them again multiple times. They are effective, but they're effective mainly if you use it in conjunction with social distancing. So none of these things work alone by themselves. You want to make sure you do them in conjunction with each other. But the masks will help protect you. One of the biggest things they do is they actually help protect other people from you. So essentially think of it as you covering up when you cough and sneeze. Essentially, that's what that's doing. It's not letting those respiratory droplets get out, and so other people can't get those from you as easily. Plus, we also know that people talking, especially people that are what we call aggressive talkers, much like I am, I tend to project very much when I talk, and so those respiratory droplets can go further from somebody who's talking in an excited or an expressive fashion. So those masks can certainly help keep that under control. The best way, if you've seen any diagrams, it's interesting. They'll show you that one of the best ways to cut down coronavirus is for you to wear a mask, meaning I'm less likely to catch it. If I wear a mask, you're less likely to catch it. But even more importantly, if we both wear masks, then it protects both of us, and we're much, much less likely to catch it. So not 100% protection, but they certainly help, and they certainly do a good job. And again, you can be fun, you can be creative with them. And so just do whatever you want with those things. Be fun, be creative, but at the same time, please make sure you wear them. Next question.
Hi, this is kind of the mask question again, but do you expect that kids will be wearing masks when they go back to school?
The question is, will kids be wearing masks when they go back to school? It's very highly probable they will. Maybe not when they're in a classroom, when they can social distance, but if they have recess where it's a little harder to keep them that 6 feet apart from each other, they might get that interaction that's even closer. They might say, hey, let's all wear masks just to make sure, at least initially, and when we start seeing these outbreaks crop up again. That might be a step in the direction of, let's not close schools down yet, but let's certainly get a step in that direction. So I think you might see that happening, probably not all day, every day in the classroom, but I think at parts of the school system where they're having that interaction, you'll probably see masks.
What is the science about public schools and COVID? Are they safe to use?
So the question is, what's the science about public schools and COVID? Are they safe to use? And it's essentially the same science you get with any type of gatherings that you have, be it the workplace, be it conventions, be it parties, be it schools, anything like that. The main theme here is getting that social distancing under control and making sure that people who have symptoms, who you think might be sick, aren't in that environment. And if you do find somebody who's sick, of getting everybody that was in contact with them quarantined. And so I think schools can be safe. It's just a matter of being creative about how we do that. So I don't think, at least in the fall, at least till we get that vaccine, we're going to see schools the same way we saw this last year. I think instead you're going to see schools maybe with a variety of different things. They might only have half the students come for 2 days of the week and the other half the students come for the other 2 days of the week, and then they homeschool in between. Might be lunching in the classroom instead of the cafeteria, so there's not that interaction and intermingling. Recess might be completely different or non-existent in some of these schools. So it just depends, but I think we can do it safely. We just have to make sure we have the systems in place to do that safely.
What about swimming pools?
So the question is, what about swimming pools? And I've said this all along, especially last week before the weekend, because we knew people were going to go out and go to pools, beaches, and lakes, which is fantastic. You're much more likely to catch coronavirus from people at the pool, the lake, or the beach than you are from the water. It's a respiratory virus, doesn't live in the water very well, doesn't transmit in the water, and especially in treated pools. Pools that are treated with chlorine or any of the other things they're treated with, the virus does not live very well in there. So you're not going to get it from there. But instead, you're more likely to get it from other people that are in the area. And if you've seen some of these beach shots, some of these lake shots, you've seen tons of people in there not social distancing, not wearing masks. And of course, you don't want to wear a mask when you're in the water. It's hard to do. But at the same time, even when you're in the water, you want to make sure you social distance. That's extremely important because oftentimes we forget about that. And so regardless of where you go, social distancing outside of your quarantine, your little group of people, your family in particular that you're with, that you know are safe and you've been with for the past 2 months, outside of that, make sure you 6 foot social distance from everybody else. If you can't do that, wear the masks. Should not be in big gatherings. 10 or less is the name of the game right now. And so we can be safe in these areas, at the beaches, the pools, the lakes, but you just have to make sure that you are safe. Next.
How many people are testing false negative? I'm sorry.
So the question is, how many people are testing false negative? It's difficult to give you an exact number because the rates depend, number one, on the test and also on the area and the environment. In some places where they're doing heavy tests, you might get more or less numbers. And so it's hard to tell exactly how many people are testing false negative at this point. The main thing to realize is that people do tend to test false negative. Depends on the test itself, and it depends on whether it's the diagnostic test or the antibody test. The antibody tests, some of them have higher rates of false negativity than we'd like. The diagnostic tests, not as much. But for the most part, these tests go anywhere from 75 to 95% accurate, so even up to 98% accurate. So again, it's a smaller number, but it's still a number that's there. So.
If someone in my family tested positive for COVID-19, should I get a test?
So the question is, if someone in my family tested positive for COVID-19, should I get a test? That's a tough question to answer because right now the tests, depending on where you are, a lot of times they're restricted to people that are just symptomatic. Some they've expanded and said if you're not symptomatic but you're around somebody who tests positive, get the test. But the caveat, the thing to remember is just because you get the test today doesn't mean the test wouldn't be positive 2 days from now. So getting a negative test, even though it might be accurate, it might not. It might be a real negative, not a false negative. Doesn't mean that you're not going to get that 2 days from now because it depends on your viral load. That's what the test is detecting. And so if the viral load isn't high enough to get that test, even though it's an amplified test out there showing a positive, it's not going to show anything. And we saw the example in the White House where there was somebody that was close to the president that tested negative one day, tested positive the next day. And so that's the way it works. So even though you get the test, you still can't let your guard down and you still need to do all the right things, even if it does show that you're negative.
Plan for travel this summer?
So the question is, how do we plan for travel this summer? And the answer is very carefully, depending on what you do. If you can go on the airplane, you'll definitely watch what the airlines are doing. We recently just traveled on an airline and they were great. They had the middle seats restricted. Nobody was in the middle seats. You only sat with the other person you were with. In my case, I just was with my wife and nobody else. Everyone wore masks. You had to wear them on the airplane. Hand sanitizers were in place. They gave you snacks in little bags instead of giving them to you individually from a big collective cart. And so they were doing what they could to keep you safe. At the same time, realize that even with those steps in place, you're not keeping that 6 foot distance, and the masks only do so much, so the risk does go higher when you do that. That's for plane traveling. The nice thing about plane traveling is it's very short, so you can get somewhere in less than a day, obviously, across the country. Car traveling, you're isolated to your little group, so you're safe inside the car. But since car traveling takes longer, you do have to make stops. Those stops are where it's going to be risky, and so you have to be careful, especially when you're at a gas station or a restaurant or anything like that. So my advice has been to people, stock up on food, only stop for gas and restaurant breaks. At restroom breaks. When you go to restroom breaks, make sure that you really wash your hands well. Only touch the surfaces you need to. There are some devices you can use out there that you can open doors and things without touching them. Those might be a good idea to use as well. And then definitely the same thing before you get back in the car. Make sure you sanitize your hands. You do everything appropriate to keep you and the other people in your car safe. So certainly want you to enjoy your summer. I certainly want you to go out and do the road trips and the flights and those types of things if it's one of those things that you think you can do safely. At the same time, if you're a high-risk individual, if you're above the age of 65, if you have other pre-existing conditions, then think about how you want to do it. Just make sure you do it very, very safely and correctly.
If it's a windy day, are we more at risk of contracting COVID-19? Does it spread faster with the wind?
And this is an interesting question. If it's a windy day, is it more likely to spread COVID-19? Does it spread faster? And the answer is yes, that is true. We talk about 6 foot distance. That 6 foot distance is typically in an area like this where I'm inside a room and there's no wind moving. And so those respiratory droplets, if I cough or sneeze, they're going to go out 4 or 5 feet. And so somebody 6 foot typically won't get them because these are heavy droplets. And even though they'll float for a little bit, they'll drop to the ground. There's been some studies showing that they might last in the air for a few hours. Those are usually studies that they were used in a nebulized type system where it was purposely thrown up in the air and it was aerosolized. And so those are smaller particles that can float longer. But for the most part, while we're coughing and sneezing, it's those respiratory droplets. The issue is, if you think about it, if I cough or sneeze, or even if I'm talking and those respiratory droplets come out about this far, if the wind's pushing behind me, it's going to shove those even further. And so if it's a windy day and you're downwind, that 6 feet might not be enough. You might need more than that depending how windy it is. So one of the things I always tell people is simply, if there's other people, try to get upwind from other people. Because getting upwind, it's going to, number one, that 6 foot distance, it's only going to travel a foot or two because the wind's pushing it back. And number two, then you don't have to worry about them, being on the other side of you and that respiratory droplet coming your way. So yes, theoretically it can go further, and it probably does go further. But at the same time, it's one of those things that you just have to be extra careful with. Any more?
One last question. Are those apples real?
So the question is, are these apples real? Yes, these are very real apples, and I have to give my wife credit for that. She liked the way they looked, and we make a joke about it. The reason we have it there is because of an apple a day. Of course, keeps the doctor away. It's one of the main things you want to do. So again, going over the headlines here, is we're talking about seeing spikes in cases and seeing a second wave coming this fall. But before then, I think over the next week or two, you're going to see spikes in cases and hopefully not a whole lot of outbreaks because of this past weekend where people got together in huge groups without social distancing in some areas. And then number two, the unfortunately 100,000 people were very close to reaching that grim milestone, as we call it, of the deaths from coronavirus. Not something we wanted to see, but it's the reality of where we are right now, so hopefully it doesn't go much higher than that. And then number three, the CDC website that shows you all the different cases. They just came out with the numbering and everything. And so it looks like it's going to be a good resource for people to use. So again, the main theme here is, I know it's been a couple months. I know people are tired. We're finally starting to get out and reopening things up. Just make sure you do it appropriately and safely, both whether you're a business owner or a business patron. You want to make sure that everything's in place and done safely and correctly. We just need to keep our guard up over the next few months, probably through the end of the year, just to make sure that, if things do start cropping up, we pull back a little bit, get back in our houses, social distance more, and then we can slowly let things open up. Hopefully we get the vaccine sooner rather than later. But until then, we definitely need to make sure that we do the right things to stay safe, but also make sure that we enjoy our lives, enjoy our summer, and just do the things we can to reconnect with people, be it social media, or even if you can social distance 6 feet apart, I can certainly talk to somebody and certainly enjoy spending some time with them. Don't necessarily need to be right next to each other. But again, different ways, be creative about doing these types of things. So thank you very much. I hope you have a fantastic week, and please stay safe.